Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Breast changes and diseases. Introduction. Many women experience breast changes. Breast changes are very common and most are not life-threatening. However, some breast changes can be caused by serious problems. Some examples of breast changes include a lump in the breast, nipple discharge or changes, or skin changes. These changes may be referred to as breast abnormalities. This program will help you understand breast changes, including common causes. It also discusses when to seek medical advice and reviews some of the tests that may be used to diagnose breast diseases. The breasts. The breasts contain fatty tissue and glands. The glands are responsible for making, storing, and delivering milk after a pregnancy. They are responsive to many of the female hormones, such as estrogen and progesterone. The milk is made and stored in the glands inside the breast tissue. From the glands, milk flows through special ducts to the outside, passing through the nipple area. The breasts rest on a chest muscle, the pectoralis major. Near the chest muscle, a nerve passes on its way to a muscle that controls the shoulder. All the nerves going to the arm pass the axilla or armpit region. These nerves are accompanied by important arteries and veins. The underarm region contains many lymph nodes. Lymph nodes are specialized structures that allow excess fluid to drain back from the breast area and the arm to the bloodstream. Lymph nodes play an important role in fighting infection, but breast cancer could spread to other parts of the body through lymph nodes. Breast health. Most women experience breast changes at some time. Your age, hormone levels, and the medicines you take may cause lumps, bumps, and discharge. Minor and serious breast problems have similar symptoms. This is why it is important to check with your healthcare provider if you notice any breast changes. Many women fear that breast changes mean they have breast cancer. However, most breast problems are not cancer. Some women do regular breast self-exams to check for lumps or other changes. Regular breast self-exams can help you learn how your breast normally feels. Regular breast self-exams can also make it easier to notice and find any changes in your breasts. However, breast self-exams aren't a substitute for regular mammograms. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Common causes of breast changes. There are many causes of breast changes. The following section examines some common causes of breast changes. Fibrocystic breast condition is when a woman has painful, lumpy breasts. Hormone changes that take place during the menstrual cycle are likely the cause of fibrocystic breast condition. Cysts are another cause of breast changes. Cysts are lumps filled with fluid. Breast cysts often get bigger and may be painful just before your menstrual period begins. Fibroadenomas are hard, round lumps that may feel like a small marble. They may move around easily and are usually painless. Fibroadenomas are most common in women under 30 years old. Another common cause of breast changes is intraductal papillomas. Intraductal papillomas are wart-like growths in a milk duct of the breast. They are usually found close to the nipple and may cause clear, sticky, or bloody discharge from the nipple. They may also cause pain and a lump. Blocked or clogged milk ducts may cause a condition called mastitis. Mastitis causes the breast to look red and feel lumpy, warm, and tender. It is most often seen in nursing mothers. Milk production when a woman is not breastfeeding and injury to the breast are also common causes of breast changes. When to seek medical advice. You should call your healthcare provider to make an appointment as soon as you notice any breast changes. No change is too small to ask about. A lump may be one change that is easily noticed by a woman. A lump may be in or near your breast. It may also be under your arm. Thick or firm tissue is another change to ask your healthcare provider about. Sometimes a woman may notice a change in the size or shape of the breast. Nipple changes should also be brought to your healthcare provider's attention. For example, a nipple might point or face inward into the breast. You should also tell your healthcare provider about any nipple discharge. Nipple discharge is any fluid that is not breast milk. It may be different colors or textures. It may be caused by birth control pills, some medicines, or infections. Another reason to seek medical advice is if the skin on your breast changes. This may include itching, redness, scaling, dimples, puckers. Tests and diagnosis. Some tests used to diagnose breast diseases are part of a regular checkup. Others may be done if these regular tests show an abnormality. A clinical breast exam is part of a regular checkup. During this exam, your healthcare provider checks your breasts, nipples, and under your arms for any abnormal changes. A mammogram is an X-ray of the breast. It allows the doctor to look at images of the inside of the breasts. A mammogram can find changes that are too small to feel. Check with your healthcare provider to find out when you should start getting regular mammograms. Your healthcare provider can also recommend how often you should get a mammogram. Mammograms should be started early and done more often if a patient has a strong family history of breast cancer or has already been diagnosed with breast cancer. Mammograms can be used to diagnose bumps and lumps felt by the patient or the doctor. These kinds of mammograms are called diagnostic mammograms. Mammograms can also be used to find cancer that cannot be felt in a breast examination. This kind of mammogram is called a screening mammogram. An ultrasound may be done to learn more about a change in the breast. An ultrasound exam uses sound waves to make pictures of breast tissue. It helps show whether a lump or mass is solid or filled with fluid. A fluid-filled lump is called a cyst. An MRI uses a powerful magnet, radio waves, and a computer to take detailed pictures of areas inside the breast. It may be used to learn more about changes in the breast that are not found with a mammogram or ultrasound. A biopsy is a procedure to remove a sample of breast cells or tissue or an entire lump. The sample is examined under a microscope to check for signs of disease. A biopsy is the only way to find out if cells are cancer.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Breast diseases are a result of abnormal changes in the breast. Breast changes are very common. Most breast changes are not cancer. Most women experience breast changes at some time. Your age, hormone levels, and medicines you take may cause lumps, bumps, and discharge. Some examples of breast changes include a lump in the breast, nipple discharge or changes, or skin changes. There are many tests that can be used to check breast changes. These tests help determine whether a breast change is minor or serious. You should call your healthcare provider to make an appointment as soon as you notice any breast changes. No change is too small to ask about. Thank you for using Explain.